Welcome to the Commission of Behavioral Health, and we appreciate your patience with us as we establish quorum. My name is Al Rolette, and I have the pleasure of serving as the chair of the commission. We'd like to take roll and establish quorum. Sandra, would you please take roll?
Thank you, and I ask all commissioners joining us online to please turn on your camera and to unmute yourselves to make the process go a little bit smoother. Commissioner Alvarez. And if you are joining us online, please do disclose whether you have anyone over the age of 18 joining you. Commissioner Alvarez. Marking absent. Commissioner Baer. Marking absent. Commissioner Burnick. Marking absent. Commissioner Bontrager.
Here.
Commissioner Brown.
Here.
Commissioner Bunch. Marking absent. Commissioner Callan.
Here.
Commissioner Carnevale.
Here.
Commissioner Contreras. Marking absent. Commissioner Designee Swartz.
Here.
Commissioner Cross. Marking absent. Commissioner Fairweather. Marking absent. Commissioner Fernandez.
Here.
Commissioner Gordon. Commissioner Designee Pumano. Commissioner Hill. Marking absent. Commissioner Larson.
Here.
Commissioner Madrigal Weiss.
Here, and nobody over the age of 18 in the room with me.
Thank you. Commissioner Mitchell. Commissioner Robinson. Commissioner Southard.
Here, and I'm alone.
Thank you. Commissioner Thomas Beckett. Marking absent. Commissioner Sy.
Here.
Commissioner Wilkes. Marking absent. Commissioner Chambers.
Present.
Commissioner Roulette.
Present.
We have quorum.
Thank you, Sandra. Next, I'd like to ask the commission staff to please go over the public comment procedure. Please go ahead, Mariani.
Thank you, Chair. If you'd like live meeting transcription or closed captioning, please activate the closed captioning feature located in the control bar at the top or bottom of your screen. If there are any members of the public using translation technology, please notify the chair so that we can be mindful. You may request to make public comment by submitting a card, clicking the raise hand icon on your computer or the app, or if calling in by phone, push *9. Members of the public can also email us public comment to be shared at a future meeting at publiccomment@bhsoac.ca.gov. For members of the public in the room, if you have not already, please use one of the green public comment cards located at the front table to indicate you would like to make comment on any of the agenda items. Cards can be given to staff located at the front table. When it is your turn to comment, I will call you to the podium or unmute your line and announce your name or the last 3 digits of your telephone number. Members of the public should be prepared to complete their comments within 2 minutes or less, depending on time constraints. We truly appreciate your understanding with this process.
Thank you, Mariani. I'd also like to note that while the agenda order has been rearranged, we will reference the original item numbers to ensure the meeting materials are easily followed by members of the public and those commissioners who are online. We're going to now move to agenda item 2, announcements. We have quite a few announcements, so please, again, if there are questions during public comment, you can certainly ask those. The Behavioral Health Services Act directs the Behavioral Health Services Act directs the California Department of Healthcare Access and Information, or HCI, to identify behavioral health workforce needs across the state and guide the strategic use of BHSA funds to support workforce development initiatives. HCI recently released their 2026-2030 Workforce Education and Training Plan. The plan details how HCI will spend the BHSA funding they will receive in the next 5 years. This includes training, supporting, retaining both county and non-county contracted behavioral health workers, with a particular focus on increasing racial and ethnic and linguistic diversity of providers and enhancing access to services in underserved communities and areas. Additionally, the initiative will offer technical assistance to county contracted providers to recruit and retain the workforce and support the workforce and support peer support specialists within the behavioral health system. The Commission has consulted with HCI on this plan, and now it's your turn. When the draft plan was published, we shared an email with a link and information on how to comment. If you did not receive that email, you can find the web plan on HCI's website, hcai.ca.gov. Navigate their workforce menu and click on Grants for Organizations and then Behavioral Health Programs. Or use the search tool in the top right and search for WET Plan. Again, use the search tool in the top right and search for WET Plan. Next announcement, in line with our transparency efforts, we will continue to provide brief updates on recent contract amendments during all committee and commission meeting announcements for informational purposes only. This month, we have 3 new contracts under $100,000, which have been executed under designated authority. We also have 1 interagency agreement. Interagency agreements under $200,000 may be executed under designated authority. 1 contract with University Enterprises, Inc. for student assistant, and 1 contract with LinkedIn Marketing to publicize our BHSA partner toolkit, 1 contract with Dunning Consulting for parliamentary training and consulting for commissioners and staff, 1 interagency agreement with the State Controller's Office totaling $163,000 for the term of January 1, 2026 through December 31st, 2028. The State Controller's Office has established Department Agency Readiness Teams, DARTs, not the kind you throw, to support project readiness, change management, and communication between the California State Payroll System, CSPS project, and departmental stakeholders, pardon me. This is a required agreement that all departments must enter into to support the CSPS project. Temporary DART funding helps offset eligible departmental costs during implementation. Announcement number 3. This month, we also have 2 contract amendments to announce pertaining to the Mental Health Wellness Act 0 to 5 grant, as it was determined that a more optimal approach is to streamline the technical assistance and evaluation efforts by consolidating this work under 1 contractor. As such, contract amendments are as follows. Cancel the $399,000 contract with the University of California, San Francisco, and amend the current contract with the Public Health Institute using the remaining funds from the canceled UCSF contract. Announcement number 4. Next, I'd like to announce changes in committee appointments. First, I'd like to announce that Commissioner Chambers will be leaving the Program Advisory Committee. I want to thank her for her hard work and her effort. Thank you very much. And I think that does warrant all applause. Thank you very much. And I appoint her to the Legislative and External Affairs Advisory Committee. I'd also like to appoint Commissioner Palmano as Vice Chair of the Budget and Fiscal Advisory Committee. And I, as a chair, can't wait.
That's right.
If you ever wanted to know if your legislative folks know how to crunch numbers, she does. Additionally, I have a double announcement. First, that Commissioner Robinson will be leaving the commission, and this is his last day will be actually tomorrow, officially as a commissioner for the BHSA OAC. And I do think that warrants a round of applause. Thank you.
You're amazing.
Commissioner Robinson, if we had more time, I would say more, but I have your phone number, and I'm going to say a lot to you when I call you. But thank you, sir, for your commitment, your steadfastness, your commitment to the people of the state of California. I really appreciate it. And if one other commissioner would like to make a comment, that would be fine. And then, of course, our executive director. Is there one other commissioner comment would like to be made? Okay, okay, Vice Chair, very quickly.
Very quickly. Look how I'm always told to be very quick. I just want to say I'm just honored as someone that's a believer and that was, trained to be a public servant and to always serve. Since the time I met you, Commissioner Robinson, you've, just as a man of color, you've exuded excellence and integrity. You're an example that I'd like my son to be able to come out in the public and to exemplify excellence and expertise and the knowledge. You've helped us bring this commission to, to stabilization. And you've just been a light, and I am grateful to serve, and I'm honored. And just thank you so much.
Well said. Very well said.
Thank you so much. Echoing all of what Commissioner Chambers said and adding that as the new executive director, I just want to personally thank you for, I think, your wisdom, your expertise, and your integrity, I think, and you've always made yourself available to me. We've had monthly meetings, and Commissioner Robinson's always been there, and even if I just needed to bounce something off of you, just really appreciate that, and I agree. I think you've definitely done a tremendous amount to set this commission up for success, so thank you and wish you very, very well.
Commissioner Robinson, if you would just take very brief because of issues. Very brief comments.
I will be brief. It is really a highlight of my career to be able to serve in this way. So those who don't know, I'm a psychologist by background. And so to be able to serve on this commission for the state of California and really be able to address the needs of patients and families and try to support people to drive innovation and improve access to behavioral health is, again, a highlight of my career. I started as a public servant. I've been in the private sector now for a little while, so it's been great to be able to be in this role and serve the people of California. I'm not leaving town. I'm still here. Feel free. I will be watching you all to make sure that you continue the great work. But again, thanks to all of you. I've had meaningful connections and comments and time with each and every one of you, and I'm proud of that. And also, I certainly want to thank the staff. I've got to know a number of them and the way that they help set us up for success and interface with us to make sure we are able to deliver on the mission. I'm really proud to know you all and to have had those interactions. So thank you all.
Thank you. Yes, you did do well, Commissioner Robinson. Thank you so much. Good job. Yeah. Okay.
This is really quick, and it's just really cool to go into Kaiser and to see your picture all over. And so I had an issue at Kaiser, and I actually went to your office, and your staff was so gracious with me. You weren't there, but I did share that we sat on the commission together. So you've done a very great job training them as well. So thank you.
I plan on going into Wells Fargo Bank and saying the same. We sit on the commission together, see where that gets me. All right. Thank you, Commissioner Robinson. All right. Lastly, there are additional vacancies on the Client and Family Leadership Committee and the Cultural and Linguistic Competency Committee. We will discuss. Yes, we have to discuss those under agenda item 13. Given the changes in the agenda, so you guys, thank you for keeping me. Thank you for keeping me. I also want to make sure that I appoint Commissioner Madriel Weiss to the Workplace Optimization Advisory Committee. She'll be taking Commissioner Robinson's place, and thank her for agreeing to take on this important role. Commissioner Robinson has been leading again, the WOAC committee and done an exemplary job. Thank you, thank you. Thank you. And again, as I said, we'll be talking about the Client and Family Leadership Committee and the Cultural and Linguistic Competency Committee under Agenda Item 13. Announcement number 5, also providing an update that the Innovation Partnership Fund procurement is well underway. I wanted to thank staff for their hard work. As a reminder, that at the January Commission meeting, the Commission approved the Innovation Partnership Fund Grant Procurement Outline Plan not to exceed $20 million and delegated to the Executive Director to conduct a competitive solicitation, issue a notice of intent to award to the highest ranked proposer. How many proposals did we receive?
Over 300.
Over
We had
300 proposals.
High volume, yes.
Very high volume of proposals. This has created a unique opportunity as the Commission, again, as I said earlier, will issue a notice of intent to award to the highest ranked proposer and execute all resulting grant agreements in accordance with the approved outline and plan and application procurement laws. This created a firewall between all commissioners and the Commission staff working on the procurement. And so again, I want to make sure I restate that. It's fairly obvious the intent and what the meaning is. It has created a firewall between commissioners and the Commission staff working on the procurement. Announcement number 6. I'd like to mention that the Commission announced its intent to award the Behavioral Health Student Services Act Performance Management Technical Assistance Grant to Santa Clara County on April 20, 2026. The formal protest period ended April 27, 2026. We look forward to the results of Santa Clara County's work. Announcement number 7, I'd also like to mention that AB 2003 was read a third time on May 26, 2026. I'm going to repeat that because sometimes I think it needs to be repeated so I'm clear. I'd like to also mention that AB 2003 was read a third time on May 26, 2026. The urgency clause was adopted and the bill passed the Assembly. It has now been ordered to the Senate for further consideration. That concludes all of our announcements this morning. Thank you very, very much. Are there any questions or comments from commissioners? Mariani, could you please transition us to public comment?
We do not have any public comment.
Okay, I want to also announce that Commissioner Bear, thank you very much, has also joined the meeting. Welcome, Commissioner Bear. Okay. And Mariani, could you please restate that?
So this is public comment for the announcements. We will do general public comment momentarily.
Okay.
We have one. Let me see. Kevin, your line's unmuted. If you have a comment for the announcements, not general public comment.
Oh, I was looking for general public comment. Thank you very much.
Okay, thank you. We'll move to that in a couple of items.
All right. So we're now going to move to agenda item 4, and I'm going to ask the team to make sure that you help me as we've changed the outline, just to make sure that I'm on track.
I think we're on 3. Item 3,
Item 3.
which is Executive Director's update.
How could I skip that? I know how, because I flipped the page the wrong way.
Okay.
All right, Executive Director's update. It's agenda item 3. Thank you very much, Brenda. Brenda, please share your updates.
Okay, fantastic. Thank you. And I'm looking at the time. All right. If our team could bring up the ED PowerPoint for me. And just as we're getting the PowerPoint brought up, given the changes to our agenda today, I will kind of orient everybody to what is in the ED update, much of it that you can read later on. I will go over the budget today and the May revision proposed impacts to the commission and in general, and then introduce you all to Commission 2.0, which is kind of an overarching improvement framework that the commission staff team has developed. And then I will also point out to commissioners in your packets and then those online that the usual executive director update with all the activities and kind of everything that's been going on for the past 2 months since we've last met is documented in that report. And happy to answer any questions that we have when we get to that point in the agenda. So are we able to pull up the PowerPoint presentation?
Just one moment.
Cody.
I'm looking for it.
And I guess I can just get a little bit started for those of you. One of the slides, or the early slides in the ED PowerPoint, is just an outline of the budget process. It's the same slide we show in the January budget and the May revision every year, just for those who might be new here and unfamiliar with the budget process, and then just as a reminder or a reference for those who have been here for a while. But essentially, the May revision came out a couple weeks ago, so this is an update to the governor's budget that was introduced in January, and just a couple of highlights for the commissioners and our stakeholders here today in terms of just overarching impacts. The budget adjustments have total expenditures at 349.4, so almost 350 billion, of which $246.6 billion is in general fund. In terms of the budget solutions to achieve a balanced budget, we've got $3.6 billion for revenue in 26-27, growing to $5.1 billion in 27-28, and then slightly decreasing to $4.4 billion in fiscal year 2029-30. And the May revision has spending reductions and reforms at $411 million in total solutions for fiscal year 26-27, which grows to $711.9 million by 29-30. Of note are the general fund offsets. So there's, in particular, offsets that we'll flag for commissioners and stakeholders to offset general fund with Behavioral Health Services Act funding. That would be $211.9 million proposed for 26-27, growing to $226.4 million in 29-30. And there's also plans for that beyond that point, as noted in the summary. And then in terms of impacts, like proposed impacts to the Commission for Behavioral Health, the proposal includes cuts to the Innovation Partnership Fund from $20 million to $10 million per year, and that is a proposed ongoing cut. So it's a maximum of $20 million over 5 years. That would be a maximum amount of $10 million, or having it at $10 million for the next 5 years permanently. And then eliminating 6.7 in the community advocacy program. So the Commission's community advocacy program, which currently supports 16 contracts for 9 underserved populations, and is really at the heart of the work we do here at the Commission. So, Cody, if you could maybe go to slide 5. I just finished 4. And this is all in your materials. Next slide. Perfect. So again, with the Innovation Partnership Fund, again, this is the state's only dedicated statewide fund for innovation, which is really looking to design, test, and evaluate and scale effective behavioral health solutions across counties. And really looking, again, it used to be innovation was dispersed amongst the counties, and then this really brings it up to the statewide level. And so essentially, cuts to this funding weakens our ability to test statewide evidence-based scalable models. And again, we've done a lot of work in the commission and with our communities to develop the IPF framework. And as a result, the IPF framework supports both community-driven and large-scale system innovations, including projects that improve access, equity, workforce capacity integration, and quality for the Behavioral Health Services Act priority populations. The immediate impact is that it would basically eliminate half of what we are in the process of being able to launch. We had over 1,000 participants join our bidders conference. Thereafter, on the questions process, we had over 400 questions, 400 inquiries, and ended up receiving over 300 applications. So the volume, we knew it was going to be high, but it's high. And so again, really, these will be launch-ready projects that we will be able to, if the funding gets restored, then we will be able to move forward with all of that. But at this point, with the proposed cuts, it will significantly hamper our ability to do that. So again, without that funding, we don't have that we lose that statewide mechanism for innovation. Next slide, please. For the community advocacy program, as I was mentioning, this is really at the heart of the work that we do here at the commission. It operationalizes the nothing about us without us that has been kind of the mantra of MHSA, now continuing on to BHSA. And really that funding works to support our advocacy grantees to make sure that consumers and families and underserved communities can really meaningfully participate in the planning and oversight of the public behavioral health system. And, as required by statute, the Behavioral Health Services Act does need to include funds that help consumers and families ensure that state and county agencies consider their concerns about quality and effectiveness and service delivery and access. And it's really culturally rooted, so we have different advocacy contractors, including LGBTQIA+, diverse racial ethnic communities, veterans, our K through 12 youth, clients, consumers, families, parents, transition-age youth, and immigrants, refugees, both a statewide and a local contract for that. So really the immediate impact of that cut, and that is a complete elimination of the advocacy program, of the community advocacy grants. And so we would lose being able to have that community-led capacity, especially at this point where BHSA is really seeking to uplift a robust community partnership. It stops the multi-year contracts that we have midstream, which would disrupt workload already underway and leave organizations uncompensated. And it really would weaken that accountability mechanism that we have and reduce equitable access and could lead to more costly care. So again, a transformed system can't be built without our communities weighing in and being at the tables. Okay. So next steps in terms of the timeline, so again, May 14th was when the governor's May revision was released. On the 19th and 20th, we had our Assembly and Senate hearings respectively. Really want to thank Commissioner Tsai for joining me at the Assembly hearing again. And then also Director Savage Sangwan, which is, she's the Executive Director at the California Pan-Ethnic Health Network, or CPEN, to testify with me at the Senate on the 20th. And then negotiations will be underway, and the June 15th is the constitutional deadline for the legislature to pass the budget bill. And so from mid to late June, there will be trailer bills, and then the governor signs the budget bills, and then they will be enacted with the budget. So again, if the cuts remain in this in the enacted budget, then we will return to we'll provide updates at our August commission meeting for additional discussion and direction. Okay. I'll hold questions for just a moment, just to talk a little bit. I wanted to introduce you guys, and just as I think I have 15 minutes, and I want to leave time for comments. Next slide, please, if we can just go to Commission 2.0. So one of the things, as I took the position or came in as executive director and kind of having an opportunity to really work with the team here in the commission, and now wanting to branch out to working with the commissioners and stakeholders, starting with this meeting, is talking about what we're calling Commission 2.0, and these are like opportunities for improvements in the way that we're structured and how we do work. I started this work with our executive team last summer. I think I'd been on for a couple months at that time and did some summer internal retreat sessions, really trying to brainstorm ideas about what the work that we do here at the Commission, our mission, and what work was underway, the current infrastructure. We had the changes from MHSA to BHSA, so lots of changes, lots of things happening. So trying to really get that all brainstormed out. We also had, through our Workforce Optimization Advisory Committee, we had Leading Resources Institute brought on to help with our leadership training. So we've had, I've received executive coaching, which again, very appreciative of our WOC committee for that forethought, and then also been able to extend that leadership training to our extended management team. So we have those leadership, leverage some of those leadership sessions and some of our management team meetings to, again, think about Commission 2.0, what's our vision for where we're going to go in the coming months, but on into the future years. We also have had our CBH monthly all-team meetings with all our team members, so I was able to introduce Commission 2.0 to our team last month and get their input on that. And then, of course, we've got our strategic plan update, which is going to be later on in our agenda today. And all these things, kind of thinking of all these things together, trying to come up with a framework to organize a structure that we can really anchor to as we continue our work. So next slide, please. So for Commission 2.0, we have 3 core areas. Operational excellence, which is really looking to our internal team, strengthening our infrastructure to be able to support exceptional CBH staff team performance. So that's all of our workflows, all of our team development work falls under that area. Commissioner alignment, we have so many new commissioners, and we have our legacy commissioners, and moving from MHSA to BHSA. So taking this as an opportunity to make sure that our commissioners really have the clarity and tools and insight and support that they need to lead effectively. And then Commission Forward, which really is our stakeholders and our communities. So really wanting to strengthen our impact by really elevating and leaning into our communities to help us do our work. So I think today, given the time, I won't go into operational excellence too much, just to say that the next few slides talk about our areas of operational excellence. I will spend some time on the other 2 because I would like to get some input on that. Just go back one more, Cody, if you wouldn't mind, just in terms of operational excellence. You guys could just take an idea or take a look at this, but essentially just a little flavor of it in terms of our first area of the, really our knowledge, skills, and culture. Again, like really learning opportunities, making sure that we're getting our annual performance reviews done, which we've done this year, getting folks out into conferences and events. Was there one behind this? Yeah, there was. Okay. Establishing alignment and accountability with our infrastructure. So again, really making sure we have effective communication pathways. We're making sure we have alignment across our leadership teams. Our strategic plan falls in this area for us as well. And any vacancy rates, making sure that we're tracking our vacancy rates and keeping those as low as possible and make sure we're recruiting quality team members. And then go a couple more. So there's a few more things that we're trying, or at least we're setting goals around all of these areas. Next slide, please. And then our contracts and grant strengthening, kind of another bread and butter of our commission is all of our grants that we have. And so we're looking to even strengthen our infrastructure for our grants and our contracts to make sure that we have tight processes, controls in place, and are able to make sure we're getting quality deliverables and working very closely with our grantees and our contractors. So we've developed SMART goals across all of these, and so we actually have just deploying project management software that we will be able to use to track our SMART goals over time. Just to give a little flavor of a SMART goal for this in terms of reducing our overall vacancy rate, looking to reduce it from 23% to below 10% by June 1st. Through targeted recruitment strategies, all those things. I will say, too, this is, we have team members we've brought in to be able to help with some of this work in terms of doing the strengthening work, and so that creates new vacancies. So we're just going to stay on top of that, try to get those recruited quickly so that we can get this work underway, because those are we're able to get limited term staff, which means they're not with us for very long. So we want to work very quickly and efficiently. So just an example of a SMART goal. And then I'll move to the next in terms of commissioner alignment. And then we'll go a little bit deeper in here. And essentially the way this commissioner alignment and commission forward is set up is how our operational excellence goals are set up in terms of we've got the different priorities and then the different SMART goals that we've developed over them for each of these. For commissioner alignment, we've got 5 areas that we are looking to lean into to support all of our commissioners. One is clarifying collective priorities. Another one is strengthening meaningful commissioner participation and satisfaction, making sure that we can get good protocols in place for commissioner and CBH staff alignment and how folks work together. Commissioner behavioral health, community education and engagement, and commissioner education and training infrastructure. So I'll go into the SMART goals that we've drafted for each of these. So for clarifying collective priorities, I won't go into too much, I won't read off the screen, but essentially it's our strategic plan update. So all the dates there are essentially what we've been doing with our strategic plan update, the advisory committee. Today we have it on our agenda to present the final addendum, strategic plan addendum with the 4 priority areas. If we are able to if the commission decides to adopt that, then we will work with Leading Resources Incorporated to develop goals and operationalize that plan. And then we would start reporting on those goals in these meetings as part of the ED update. And then just another part of that is our strategic plan. So just putting that on deck. So this is the strategic plan update is our addendum, but then right on the heels of that, we're going to start having to think about the work that we're going to do our full strategic plan update, because the existing strategic plan goes through the end of 2027. So again, in terms of for commissioner alignment, again, we have many new commissioners, and so wanting to make sure everybody's on the same page and anchoring to that strategic plan update on into the next strategic plan. Next slide. For strengthening meaningful commissioner participation and satisfaction, we implemented a commissioner connector biweekly newsletter so that we can make sure that we've got a way to communicate amongst the commission and make sure our commissioners are updated on the staff work, any program updates, or any other partner news that we have that we want to make sure is on everybody's radars. We also started adding into our committee presentations and our key discussions highlights for our committee, I should say, sorry, excuse me, let me back up. We also have developed a committee to commission blog. So one of the things that we had heard through the discussion in these meetings was we needed a tie back from the committees to this commission. So that goal of that committee to commission blog is to provide those summaries to our commissioners so that when we have full commission meetings, everybody can show up and know what had happened in the committees. And then we also have started working to incorporate a multimedia presentation in a segment into our commission meetings. Last commission meeting, we did the bridge in San Francisco, so we had that. And then the other piece is that we're looking to do a satisfaction survey for our commissioners to kind of gauge, see how things are going, do a check-in, see what we could be doing to improve our commission processes, our meetings, any of that, and also planning for next year's. Next slide. In terms of commissioner CBH staff alignment, we're saying that by the end of July, we would establish a structured commissioner SME staff engagement model, subject matter expert, what I mean by SME, model that includes defined roles for our committee presentation, regular interaction opportunities, and coordinated communication practices. And so we know that this is something that I know our team, our CBH staff team really enjoys working with commissioners. I think commissioners really enjoy working with the team on different projects, and we just want to make sure we do that in a very well-structured way. Next slide, please. In terms of the community commission and community engagement, education engagement, we are looking to have a site visit. So we've heard that as well, of wanting to bring back site visits. We've kind of been on a little bit of hiatus for a while, and everybody really enjoys that. Trying to be mindful of the budget as well. So that's the other piece we've been balancing, So anyway, but wanting to really bring those back and kind of be thoughtful and at least try to do that once a year. Next slide. In commissioner education and training, I will say we've got some dates around this, but essentially we're implementing a learning management system for our internal team, but also for our commissioners. So we can put training electronically, be able to track it, and make sure that we can get information out to all of you, and that you have a place to all in one place to be able to reference those training materials. Next slide. In terms of, so those are all the commissioner alignment goals. And so moving to commission forward, the 3 areas we've identified are increasing general public understanding and visibility of our commission and engaging with purpose. So really trying to, broaden our stakeholders and folks who are engaging with us that we're reaching out to. Increasing county behavioral health and their contracted providers, the partnership with them and get them engaging with purpose as well. So again, this is just an area where we're seeing that county behavioral health has been kind of a little more involved, but not deeply. So really trying to get those connections in place, and then really working to build trust and relevance with our communities. Next slide. So in terms of the goals for this area, for increasing our, increasing our participation base is really, leveraging our updated strategic plan to really develop and launch a commission visibility engagement strategy. And then we would, include messaging, our update our website, all our public-facing materials, and really integrating stakeholder engagement into all of our commission activities. Purposefully and meaningfully. Next slide. In terms of really engaging our counties, developing a structured county and provider engagement strategy that really communicates our role and what our priorities are, and what our impact is, and really defines how we'll partner with county behavioral health departments and their contracted service providers to really inform and strengthen our work. So many of our grants are focused on improving those systems. We want to make sure that we're communicating and collaborating. Next slide. And then this last one, in terms of building trust and relevance, establishing a framework for that, really leveraging our CBH advocacy grantees. So again, like I said, the advocacy grantees are very much at the heart of what we do here at the Commission. This was written before the May revision proposal, but this would be where we would really want to lean into our grantees to really help us engage stakeholders, really get more folks here at our commission meetings and really promote our activities. And then really get intentional about our conclusion of diverse perspectives into our planning and decision making. And then the other piece of this is our CFLC and CLCC really leaning into to those meetings and our listening sessions to gather stakeholder voices, and then developing a process for stakeholder feedback. And we're also thinking about doing a survey as well of our stakeholders through our listserv, just to be able to get community impact and really understand the trust, transparency, and relevance of our work to our stakeholders and our communities. I think that's the end of that. Next slide. So in terms of the work, we'll have a little bit of time. I don't think we have too much time, but some time for feedback from commissioners. Also welcome public comments, written comments as well, if anybody has ideas or thoughts. It doesn't have to be a one and done. It could be a living, breathing, evolving work that we do in terms of our Commission 2.0. And then we would, if the strategic plan is adopted today, we would include that into the work that we're doing, fold in our CBH Workplace Wellness Work Group. So we have the triple dub, as we call our wellness work group, into the Commission 2.0, so that we're tracking all of these goals. We want to develop SMART goals for everything and track them and make sure we're making progress. All right, with that, I think this next slide is probably commissioner discussion. So any and all feedback, welcome.
I'd invite commissioners to make brief comments or ask questions if you have any. You dazzled them. Much more will be said about the advocacy from
Commissioner Kell.
Oh, yes.
Thank you, Executive Director. I love this, and I think our commission does so much good that I really think the redesign and getting it out to the public on what we're doing it will be so loved that they would never think of taking money away. So, because there's so much good we do, and I think it's just a matter of getting it out so people understand it across all media. And I think that we're going in that direction. I think that's really exciting.
I would hope that everyone was like you, Commissioner Kell, and I know that they're not, but they should aspire to be. And then secondly, I think that one of the things that your plan does do is it moves the commission to be more impactful and not just a metric-based plan. And measuring impact is important in this day and this fiscal period, and much more to be said about the importance of the impact of the commission as it relates to the viability of the commission. But nicely done. Thank you. All right.
Next is public.
Yes. All right, we'll move now to public comment. Oh, sorry. Okay. Commissioner Robinson, this is your last meeting. I'm gonna go back. I didn't see your hand.
Well, I just wanted to thank Brenda for the thoughtful attention she put into this, and I think it's thinking about evolution of the commission, how it evolves in the changing landscape with which it exists is important. So I love the pillars of it and the focus on continuous improvement, and I just think it's a good direction.
Thank you. Now we're going to transition to public comment regarding Brenda's presentation, the Executive Director's presentation. This is not our item 4, which is the general public comment. So I'll transition to you now, Amariani.
Thank you. So again, this is public comment for the Executive Director's update. First, we have Joseph. Your line is unmuted.
Sorry, I don't know why my thing is labeled as Joseph. This is Grace Gallagher. I'm the Advocacy Program Manager with Painted Brain. I wanted to speak specifically on the prevention component of the Continuum of Care framework developed by DHCS, moving to the Department of Public Health. I appreciate the effort to create a framework.
So sorry. Were you trying to do just a general public comment? Because that'll be our next item.
Oh, yes, sorry.
Okay. Thank you.
So if you have your hand up related to general public comment, we can, if there are no comments about the executive, keep your hand up. If there are no comments about the Executive Director's presentation and report, we are now going to transition to general public comment. Okay, Brenda, please.
Sorry, if we are transitioning, I did want to say thank you. In terms of the development of Commission 2.0 as that framework, that was, I just wanted to thank our CBH executive team and the extended management team, because they did a lot to help me develop this, and to the LRI team for a lot of guidance and to help develop this. And then also our team members within CBH was able to present this last month, in April, at our all-team meeting, and there was so much energy. I really appreciated the team for really kind of rallying around this and getting excited about it. And then to all the commissioners and our stakeholders, because a lot of the comments that we hear in these meetings, that I've heard in these meetings, and that I've heard in our public comments, and just even our committee meetings, has really helped shape the thinking. So appreciate those voices, because even if something doesn't feel like it's impacting things in the moment, it really does influence thinking overall. So thank you, everybody, and thanks for the opportunity to say that, Commissioner, your chair.
It is now time for agenda item 4, general public comment. General public comment is reserved for comments on items that are not on the agenda. All written public comments received before the meeting have been included in the meeting materials. Please note that for general public comment, which is the portion we are now in, individuals may speak on topics not listed on the agenda. However, commissioners cannot engage in a dialogue, and that includes commission staff, as topics would not have been agendized 10 days prior to the meeting and thus would violate Bagley-Keene requirements. That said, CBH staff will follow up on topics as needed and as appropriate. Amariani, please lead us in public comment, general public comment.
Thank you. First, we'll start with comments in the room. Our first comment is from Divya.
Good morning, Commissioners. My name is Divya Shiv. I'm with the California Alliance of Child and Family Services. We represent over 200 organizations, including nonprofit and community-based, that work with children, youth, and families across the state. We are greatly appreciative of the Commission for Behavioral Health's work on the Innovation Partnership Fund and the Community Advocacy Program, and we are similarly deeply concerned about the proposed cuts in the May revise. We stand in support with CBH and strongly oppose these proposals in the May revise, and just want to reiterate our thanks to the Commission. We also continue our advocacy around ensuring adequate funding for 988 call centers and mobile crisis service centers, and we continue our opposition to restricting Medi-Cal coverage to 200,000 immigrants in the state. Thank you.
Thank you. Our next comment is from Stacy.
Good morning, Commissioners. Stacy Hiramoto with Remco and Safe Passages. Pronouns she, her, and kanojo. I would like to agree with the previous speaker, Divya, in that we really support the Commission's advocacy and your role in innovation partnership and community advocacy. Last week, I felt so in partnership with the Commission because the California Reducing Disparities Project had what we hope was not our last annual convening, but as of now it is. But we were graced with Brenda's presence, as well as Alicia, your researcher, and I'm not going to say your last name because I think I'll mispronounce it. But they came and enjoyed meeting all of the CRDP partners and partaking in the exhibits, and we really appreciate that. And then I was very proud to be among the first to, in the Senate hearing, I wasn't able to go to, or no, it was the Assembly hearing, to support the Commission's proposed rejection of the governor's proposed cuts. And Commissioner Tsai did a good job, and I really think your Commission did a great job getting people. There were so many people speaking in support of these programs. So congratulations, and I really hope that those cuts do not go through. Oh, and lastly, I'm really, really sad that Commissioner Robinson is, he's not here. Oh, there you are. Okay, sorry, you're behind the post. I'm very sorry. I'm very saddened. That was very surprising that he's leaving, because he did really exhibit integrity and willingness. He met with the graduate students that were under me, and we appreciated that time, but his comments and his votes were always so professional and understandable and unselfish. So sorry to see you go, Commissioner. Thank you.
Thank you. Our next comment is from Tiffany.
Good morning, everyone. I can't see everyone's face. Tiffany Murphy here, Chief Operations Officer with Mental Health America of California. And I don't want to belabor the point, but I do think it's extremely important to give people flowers in real time. And so I want to echo the sentiments of the previous speakers respective to our organization and our current CBH a grantee LIVE LGBTQ plus inclusivity, visibility, and empowerment contract, as well as our concluding CBH Youth contract with CAI and the California Youth Empowerment Network. We want to thank the Commission's leadership, visibility, and collaboration with all of the CBH contractors, community partners, communities, and populations served in regards to rejecting the May revises budget cuts to the innovation and advocacy partnerships. As you all are very well committed to these particular populations and elevating the community-based, evidence-based work that comes out of these advocacy contracts and innovation contracts, I just want to simply encourage everyone and thank everyone for the collaboration. Additionally, we are committed to continuing this work and side by side with the Commission and all of our other community contractors as well. And just really wanted to make sure that we took a moment to thank you all. So thank you.
Thank you. We'll now move to virtual comments. Our first comment is from Grace.
Hi, Commissioners. This is Grace Gallagher, Advocacy Manager with Painted Brain. I did want to speak specifically on the prevention component of the Continuum of Care framework developed by DHCS moving to the Department of Public Health. I appreciate the effort to create a framework that spans promotion, prevention, treatment, and recovery. However, I'm concerned that the framework appears to rely primarily on a medical and service delivery model rather than a recovery-oriented and community-based approach. I am concerned that peer-run organizations, people with lived experience, and consumers were left out of the development of this framework to begin with. California's behavioral health system has been shaped by the consumer, survivor, peer, and disability rights movements. Principles like recovery, self-determination, peer support, trauma-informed care, and community integration should be clearly centered throughout the entire framework rather than positioned as an endpoint. So I would encourage the Commission to engage public health about modifying the framework to center recovery-oriented, peer-informed, and community-based approaches throughout the entire framework. Thank you for your time, and thank you for all of your work on advocating for the community advocacy grants and the Innovation Partnership Fund as well.
Thank you. Our next comment is from Jay.
Hi, my name is Jay Calcanio from California Behavioral Health Association. I did have some comments on item 3, but it sounded like that was skipped over. Just wanted to echo our support for the previous speakers on the Commission opposing the deep cuts to the Commission's budget, especially on the Innovation Partnership Fund, which is really crucial to innovating new technologies and practices into the behavioral health system across the state. Regarding item 3, the executive director's updates, we appreciate the thoroughness of these updates, and we especially wanted to commend the Commission for launching the first application round for the new Innovation Partnership Fund. We look forward to the updates on the application and the awarding of the grants, and we encourage the Commission to continue dialogue with stakeholders to inform improvements to that application process for future innovation funding opportunities. We also wanted to express our support for the Commission's engagement with stakeholders and encourage them to reach out, especially to providers and peer-run organizations, on the development of future strategic priorities and related items. Thank you.
Thank you. Our next public comment is from Jerry.
Good morning, everyone. My name is Jerry Hull out of San Diego. I too am concerned about the Innovation Partnership Fund and the Community Advocacy Program cuts. The Innovation Fund was originally in fiscal year 24-25. We had about $185 million distributed between all the counties to spend on innovation. And now it's going to be cut to 10 million, which I just think is laughable. I thought California was a state that was leading the rest of the country in innovation. And this just shows a serious lack of perception of what innovation is and what it means. And that by as an entrepreneur, you have to spend money in testing things out and before you can figure out what works and what doesn't. And to cut that budget so drastically is beyond me. For the community advocacy, I have a concern that at the county level, we have a really difficult problem integrating the community into the planning process, which begins in the middle of the year. And what we typically get is a plan at the end of the fiscal year and have a few opportunities to opine on it and basically, have little to no input in the actual plan. I put up a website at bhsaplans.com to illustrate a lot of ways that the community could be more engaged. And finally, the BHSA plans, the integrated plans this year from the ones I've seen, were really difficult to read as a community member. I had community members tell me, what is this? So our plan, we basically printed out the form that was used to fill out the plan. And that was the plan that was presented to the community. So it's very difficult to use, to read. And
Thank you, Jerry. Your time is up. Please wrap up.
Thank you.
Thank you, Jerry. Our next comment is from Kevin.
Good morning, and thank you all for the tremendous work that you continue doing throughout California in support of behavioral health, crisis response, and community. My name is Kevin Dredge, and I'm joining today from Placer County and the South Lake Tahoe area. Over the years, I've had the opportunity to participate in advocacy and community efforts involving NAMI, 988 awareness, peer support, school outreach, and local community engagement. What really encourages me moving forward is seeing how much progress can help when communities, organizations, schools, volunteers, and public systems work together with a shared purpose. Right now, I'm helping build the newly formed Lake Tahoe South Shore Lions Club, where we're focusing on youth vision support, accessibility, and strengthening local partnerships throughout our community. It's been inspiring to see people from many different backgrounds coming together simply because they care and want to help. I just want to sincerely thank all of you for your continued service, your leadership, and commitment to improving the lives of individuals, families, youth, and communities throughout California. Thank you very much.
Thank you. Our next comment is from Steve. Oops, 1 second, Steve. Okay, go ahead.
Hello, can you hear me okay?
Yes, we can.
Okay, great. First, thank you for all that you do. I'm Steve McNally. I'm from Orange County. I have a son with schizophrenia, and his relationships are restored. I'm also on a local board, and my comments are my own. It's really heartbreaking to see how behavioral health cannot defend itself from budget cuts. And I think part of it is that every budget cut is treated individually. So yeah, it's just another 50 million here, but in this innovation fund, but it's the start of the 2.8 billion that was taken for No Place Like Home for housing. It was the 5% that was taken. It was the reallocation of Prop 1 money, which eliminates BHSA, the MHSA every 3 years, just like wipes it away. Mike, what I would like, my ask for you all would be, it would be helpful to know what boards and commissions and stakeholder groups you're part of that we can reinforce. It would help if you could empower us to be your eyes locally. I'm not sure how many of you participate locally at your board meetings. And so to figure out how we're covering the different areas, I would suggest too that community planning still doesn't exist in California, We could be spending $100 million a year, and we continue to spend all this money without knowing what works, doesn't work. And there's tactical things such as on July 1, are all the Prop 1 changes going to be implemented? Or are they going to be like, oh, we couldn't get through the procurement, so they're going to start 6 months late or 12 months late? And those were the same issues that we had with MHSA before. So anything you can do to help, and I'll end. Anything you can do to help empower us to be your eyes and ears would be helpful. Anything that would connect us more deeply to your passions, because everybody has
Thank
influence
you, Steve.
somewhere.
Your time is up. Please
Thank
wrap
you
up.
very much. That's it.
Thanks, Steve. Our next comment is from Sung.
안녕하세요. 커미션 여러분, 저는 LA 카운티 정신건강국의 솔트포 코체어에 있는 나승열 목사입니다.
One moment. We had a translator online, but we'll have to get that back. We'll have to figure that out. Sorry. In the meantime, we'll move to Laurel.
Good morning. I'm Laurel Ben Hamida, and I'm with Mass Social Services Foundation and REMCO. I want to support the Commission in its current struggle to survive. A little chip here, a little chip there, a bigger chip there. It's very painful, heartbreaking, as Steve McNally said. I guess I could suggest one strategy. You can recommend the people who are cutting little pieces of you off every few months. Remind them that the Little Hoover Commission will come along later and evaluate and talk about what's been done. And it'll be on the public record. People will know. Right now, we're not really sure how this is all working behind closed doors, but I hope that you're strong and survive, and please call on us.
Thank you, Laurel. Okay, we're going to try again.
Yep. Thank you. We have Sung for our next public comment, and for our interpreter. Could you please use the interpretation button and switch to the original audio or main audio, please, before he speaks?
I can just English. I wrote down something. I can speak. Okay. Sorry about that.
Thank you.
Yeah. I'm grateful for the opportunity to participate in this commission meeting. My name is Pastor Na, and I serve as the co-chair of SOLT 4 at LA County DMH. I would like to ask 3 questions. First, it is possible to expand Korean language materials and the behavioral health service for the Korean community. Second, is the behavioral health education curriculum also being prepared in Korean? Third, is financial support available to translate one of the NAMI's education programs, the family program, into Korean? I believe education for family and peers is effective in recovery. I strongly hope to see the educational program expanded. Thank you.
Very good.
We will have staff respond to the speaker questions. Thank you very much.
Thank you. And that was our last comment.
Wow, that was good.
I'm not quite sure who said that, but we appreciate hearing that was good. Now that public comment was closed, we will now move to the next item on the agenda, and again, that is agenda item number 5. And I'm wanting to make sure that the public is able to keep up with us because we did have changed the agenda. and you don't have a copy of the working agenda, but you have all the information. Agenda item 5 is the approval of the March 26, 2026 and March 27, 2026 commission meeting minutes. Even though the meeting on March 26 ended with a recess and was resumed on March 27, we are splitting the minutes into 2 separate days and will vote on these minutes with 2 motions. 2 motions, commissioners. At this time, I would like to invite commissioners to offer comments or ask questions. Seeing none, Amariani, go ahead with public comment related to agenda item 5.
We do not have any public comment for this item.
Now that public comment has closed, I would like to entertain a motion that the commission approve the March 26, 2026 minutes.
I'll make the motion.
All right.
So we have Pomano moving. Who spoke for the second?
I did.
Thank you, Commissioner Madrigal-Weiss.
We have a motion and a second to approve the March 26, 2026 minutes. Are there any additional questions or comments?
Just a note that Commissioner Alvarez is online.
She's joined the meeting. Thank you. And I want to also state for the record that Commissioner Hill joined earlier as well.
Okay.
I ask all commissioners joining us online to unmute your line at this time to expedite the vote. The motion, and we have a motion and a second that the commission approve the March 26, 2026 minutes. Commissioner Alvarez.
Abstain.
Commissioner Baer.
Aye.
Commissioner Burnick. Marking absent. Commissioner Bontrager. Commissioner Brown.
Aye.
Commissioner Bunch. Marking absent. Commissioner Callan.
Aye.
Commissioner Carnevale.
Absent or abstain.
Commissioner Contreras. Marking absent. Commissioner Designee Swartz.
Aye.
Commissioner Cross. Marking absent. Commissioner Fairweather. Marking absent. Commissioner Fernandez.
Aye.
Commissioner Gordon. Commissioner Designee Pomano. Commissioner Hill.
Abstain.
Commissioner Larson.
Aye.
Commissioner Madrigal-Weiss.
Approve.
Commissioner Mitchell. Commissioner Robinson.
Aye.
Commissioner Southard.
Aye.
Commissioner Thomas Beckett. Marking absent. Commissioner Sy.
Aye.
Commissioner Wilkes. Marking absent. Commissioner Chambers.
Abstain.
Commissioner Roulette.
Aye.
Motion passes.
Thank you, commissioners. Now I would like to entertain the motion that the commission approve the March 27, 2026 minutes.
Do I have a motion?
I'll move.
Thank you, Commissioner
Second.
Larson. Who seconded? Commissioner Robinson. Thank you. We have a motion and a second for the commission to approve the March 27, 2026 meeting minutes. Commissioner Alvarez.
Aye.
Commissioner Baer.
Aye.
Commissioner Burnick. Marking absent. Commissioner Bontrager.
Abstain.
Commissioner Brown.
Aye.
Commissioner Bunch. Marking absent. Commissioner Callan.
Aye.
Commissioner Carnevale.
Abstain.
Commissioner Contreras. Marking absent. Commissioner Designee Swartz.
Aye.
Commissioner Cross. Marking absent. Commissioner Fairweather. Marking absent. Commissioner Fernandez.
Aye.
Commissioner Gordon. Commissioner Designee Pomano. Commissioner Hill.
Abstain.
Commissioner Larson.
Aye.
Commissioner Madrigal-Weiss.
Aye.
Commissioner Mitchell. Commissioner Robinson.
Aye.
Commissioner Southard.
Aye.
Commissioner Thomas Beckett. Marking absent. Commissioner Sy.
Aye.
Commissioner Wilkes. Marking absent. Commissioner Chambers.
Aye.
Commissioner Roulette.
Approve.
Motion passes.
Thank you, commissioners. Thank you, Sandra. Now we'll move on to the consent calendar. Agenda item 6. This month's consent calendar includes 7 innovation proposals and 3 new renewal contracts. All matters listed on the consent calendar are routine or non-controversial and can be acted upon in one motion. As a reminder, changes forthcoming with BHSA include removal of the innovation component. Any final innovation proposals that counties wish to bring forward must be approved by the commission and operational no later than June 30, 2026, as a result of what I just said. With this being the last meeting before that deadline, we have quite a few innovation proposals on the consent calendar today. Beginning July 1, 2026, counties can still do innovation under the 35% Behavioral Health Services Act and support bucket, yes, I said bucket, but proposals no longer require commission's approval. Any unencumbered innovation funds will be used towards BHSA components. This includes full service partnerships, housing interventions, and behavioral health services and supports categories. With that being said, the first 7 items on today's consent calendar are the county innovation proposals. From San Francisco County, Pacific Islander Innovation Project for $1,800,000. From Del Norte County, Trillium, and forgive the mispronunciation, Trillium Drop-In Teen Center for $448,730. From San Francisco, Latino, Latinx, and Indigenous Healing Centered Systems Transformation Project for $1,800,000. Santa Clara County, Program Improvements for Valued Outpatient Treatment, or PIVOT, for $4,100,000. Tulare County, Full Service Partnership Reboot for $2,114,809. Tulare County, the Horizon Project, $251,751. Lake County, Semi-Statewide Enterprise Health Record Innovation Project Phase 2, $82,471.30. I believe that is correct. Okay. These innovation proposals align with the BHSA and include plans for sustainability. Commission staff have sent the documents related to these projects to all commissioners, and a copy of the staff analysis for the proposals has been provided in your packet. The last 3 items on the consent calendar are new or renewal contracts. For each of these contracts move through the Commission's committee approval process and were recommended for approval by the full Commission. For additional detail, please see the executive summaries for each in today's meeting packet. Those include the 3 programs. Program 11, Creative Services Contract for $135,000. Veterans High Risk Security Solutions, Inc., On-Site Security Contract for $139,656. Tim Toyete, Competitive Procurement Consulting for $300,000. I'd like to invite commissioners to ask questions if you have any. Seeing none. Mariani, please go ahead with public comment.
We do not have any public comment for this item.
Thank you, Mariani. We'll put the motion on the screen. Yes.
And I'm not asking for the item to be removed, but it was on the consent calendar for San Francisco. I was just curious if staff could just define a little bit more where it says the county proposes to assess if a community defined indigenous. Could they just kind of define that a little bit more? Just what exactly does that mean in this proposal?
I'm looking to see if we have our team members here who could speak to the detail. I say, is that something I would say we could follow up with you on?
Yeah,
Is that
because
okay?
I just want to know when they state if it can be effectively integrated into a public behavioral health system. I just want a little bit more information
Okay,
on that.
we'll make note of that and follow up with that.
And we'll report back the
Information.
answer at the meeting? Okay, very good. Mariani, again, could you restate there is no public comment?
No, there was no public comment for this item.
Okay. So the motion is on the screen. Now that comment is closed, I'll entertain the motion on the screen that the commission approve the consent calendar that includes, and I'm going to just again ask you to reference the screen. Sandra, do I need to read it?
No.
Okay, thank you.
We have the motion on the screen, and you all should have it in your packets for the commission to approve the consent calendar, which consists of 10 items that have been shared. I welcome a motion.
I'll make the motion.
Pomano moves and Madrigal Wise second. Appreciate that. We have a motion and a second to have the commission approve the consent calendar. Please unmute your microphones if you are joining us online, and please speak your vote, commissioners who are joining us in the room, into your microphones so that the minutes can capture your vote, your voice vote. Commissioner Alvarez.
Aye.
Commissioner Baer.
Aye.
Commissioner Burnick. Marking absent. Commissioner Bontrager.
Aye.
Commissioner Brown. Commissioner Bunch. Marking absent. Commissioner Callan.
Aye.
Commissioner Carnevale.
Aye.
Commissioner Contreras. Marking absent. Commissioner Designee Swartz.
Aye.
Commissioner Cross. Marking absent. Commissioner Fairweather. Marking absent. Commissioner Fernandez.
Aye.
Commissioner Gordon.
Aye.
Commissioner Designee Pomano.
Aye.
Commissioner Hill.
Aye.
Commissioner Larson.
Aye.
Commissioner Madrigal Weiss.
Aye.
Commissioner Mitchell. Thank you. Commissioner Robinson.
Aye.
Commissioner Southard.
Aye.
Commissioner Thomas Beckett. Marking absent. Commissioner Sy. Commissioner Wilkes. Marking absent. Commissioner Chambers. Commissioner Roulette.
Approved.
Motion passes.
All right, everyone. We are now we're a little bit behind time, so I want to appreciate that. Agenda item 7, strategic plan, update and adoption. We are now going to have a presentation and hopefully an adoption of the proposed updates to the Commission's 2024-2027 strategic plan to ensure alignment with the Behavioral Health Services Act and priority populations. This update would add an addendum to the current strategic plan outlining 4 priorities and their desired results. It would guide the Commission's work from 2024 to 2027. Commission staff will use existing resources to implement strategies that advance these priorities. These materials were shared with commissioners approximately a week ago. They're in your packets. We are going to now transition to Executive Director Brenda Grayledge, Eric Douglas, Karen Bloomer from Leading Resources Incorporated to provide us with a presentation. Thank you, Eric. Thank you, Karen. And thank you, Brenda.
Thank you. So in the interest of time, I'll just stick where I'm at, and thanks so much to the LRI team for joining us at the table. I think what we'll do is I'll kind of go through the presentation. A lot of this everybody's already seen, so we could probably move very quickly through this to catch up on some time, because I know we're trying to break for closed session at 11:30. Next slide, please. So in terms of the discussion for today, I'm probably going to go mostly through part 1 and then just give you a couple talking points for part 2, because I just want to put some things on your radar. But essentially, the key thing we want to do today is have the presentation and vote for adopting our strategic plan update, as we also call our addendum. So I'll just give a little update on the process that we've gone through and talk a little bit about what our discussion was since we last met, we'll have a little conversation with commissioners and our stakeholders, and then we will present that vote. Part two is going to be, I was going to go through the strategies to really show the work that we're doing that's already actually underway. But we won't have time for that today, but it is all in very detailed actually in the presentation. So next slide. In terms of the process overview, everything that's grayed out is what we've done already. So you can see there's been quite a bit of work even in such a short period of time on our strategic plan update. And so all the way and up to our strategic plan advisory committee meetings that we've had up to today, which brings us to our May 28th commission meeting to present the draft plan to all of you for a consideration for a vote to adopt. If adopted today, then the next step would be for us to work with Leading Resources Incorporated, us being the CBH staff team, to operationalize it and then kind of roll it into Commission 2.0 for our overarching tracking that we would be doing at all of our subsequent commission meetings. Next slide. Again, the goal of this work was to really not redo a whole strategic plan, but build off of our existing strategic plan, putting our existing strategic plan through the lens of the BHSA as we've been moving from MHSA to BHSA. Next slide. Big thank you, shout out to all of our strategic plan advisory committee members. We were chaired by Commissioner Larson, Vice Chair Fernandez, and all the rest of the commissioners you see listed on the screen who participated in our meetings and weighed in on the development of the strategic plan update. Next slide. So in terms of the last committee meeting that we had, we took the committee meeting or the information and feedback that we received from this full commission, the full commissioners, to our strategic plan advisory committee meeting on April 27th and made some updates. And then the committee looked at the draft strategic plan update document and then had a little more discussion about that. And then by the end of that April 27th meeting, the committee had made a symbolic vote to recommend that the commission adopt the strategic plan update as the addendum to our existing 2024 to 2027 strategic plan. Next slide. Some of the edits, just to kind of point out with regard this was from the March meeting when we all as a commission got together. A couple things that came out asking for on priority one, which is meeting the needs of those with the highest behavioral health needs, that we increase statewide understanding of the standard of care experience by the BHSA priority populations, including but not limited to the full service partnerships. And then with regards to priority 4, which pertained to innovation, we had a commissioner emphasize the importance of embedding sustainability into the definition of effectiveness. And we had 2 commissioners emphasize the importance of equitable statewide implementation of any identified innovative strategies. So next slide. Next slide. So the changes that were made when we looked at our priorities for it impacted result number 4. We edited that to, again, not just focus on FSPs, but on the full BHSA priority populations with a focus on FSPs. So that was the one edit that was made as a result of that feedback. Next slide. For priority 4, or sorry, priority 2 stayed the same, which is our substance use. Priority 3 stayed the same, which was peers. And then priority 4, that edit to add sustainability into the definition and then equitable into the results. Result number 2 for ensuring long-term equitable public behavioral health system revenue stability, efficiency, and effectiveness. Next slide. We'll skip this for a second in terms of that. I guess maybe that was it. I guess that's it. I had more. Well, wait, there's more. No, there's no more. So that is it. So, so basically, again, this is very similar to what everybody saw back at the March meeting. We just had some discussion, made a little bit of edits to that. Any questions regarding that feedback?
Well, I'll just comment that we had a robust discussion in March, and so today less is actually more. Yeah. So very good.
Yes, less.
Okay. Commissioner comments? Please thank the members of the committee. Thank you, Chair, and all the other members of the committee who worked on this.
Nothing from here. We can go to the next slide, which I think is public comment. Is there any public comment on the strategic plan update?
Mariani?
Mariani, any public?
Public comment?
We have one public comment online from Colin user. Your line is unmuted.
This is Mark Carmet, and the question I have for you is, will this all affect the savings accounts that the counties have? Or are they, in other words, the prudent reserves?
No, this strategic plan is only for the commission to focus the commission's work to update it in accordance with the Behavioral Health Services Act.
I think my thought is, I had this question from when you were talking about it before, when the cuts in the budget, it's coming from the federal government.
Yep, this is not it does not pertain to anything with the federal government. This is just only our strategic plan for our commission.
Okay, thank you.
No, thank you.
And that was our only public comment.
Okay, next slide. There's a couple more slides to go. Oh, did you need to say something now? Oh, yes. So just a couple more slides in terms of the strategic plan update. So for commissioners in your materials and for anyone else participating, posted online is the strategic plan update for 2026 and 2027. The document includes the purpose, the background, the priorities and results, and the conclusion. This is essentially the document we would be adopting to be our addendum to the strategic plan. Again, this is basically to focus our work for the next year and a half. Much of it, as you'll see in the subsequent slides, is work that we are already have underway, but really focuses on these 4 priorities for the next year and a half, and then we will begin our next strategic plan, the full strategic plan work later this year or early next year. All right, so next slide, please. So just an update in terms of our committee discussion from April 27th. That committee members had offered. A couple committee members suggested it would be beneficial to cite statute for the BHSA priority population, so we added that to the addendum. And then one committee member expressed a desire to really articulate our commission's advisory role. So being able to, have broad advisory authority and being able to conduct research and studies to make recommendations to the legislature and governor. So we took that language and popped that into the beginning, or pasted that into the beginning. So that is in the strategic plan update addendum. Next slide. So at this point, I think I'll just reference that we have the strategic plan update as a separate cover as our standalone document. If adopted, this is what we will post online, and that will focus our work. Next slide, please. I think we already kind of covered this, so next slide. Sorry, we had a different, oh, go ahead. Yes.
Yeah, I just have a question. Are you proposing that this be adopted without reference to the budget cut? In other words, if this gets posted, it could be interpreted as this will be done no matter what happens with the budget, which I think could be misleading.
I think the 4 priorities would still be our priorities. So focusing on those with the highest behavioral health needs, the focusing on the SUD as a standalone, the peer work, all that stays the same, and the innovation would be, it's proposed for reduction, but still there. And so it would still matter. The 4 priority areas would still hold. It's just the activity or the strategies that we would do would be impacted. So, and the strategies are not in the addendum. So it's separate. It just lists the priorities. So it's a good question though, but it would still focus us in those 4 areas.
Okay.
Yep. Okay. So the motion's on the screen. I guess I'll turn it over to our chair.
Again, we already have had our public comment. Again, if there are no other questions from commissioners,
Maybe ask, I don't know, LRI, how do we have you guys at the table?
I
Anything to?
was going to actually
I'm sorry.
transition to our
That was-
colleagues, Eric and Karen. Thank you for being here, but thank you for the reminder. And the members of the Strategic Planning Committee, Eric and Karen, any comments from you?
Thank you, Chair. I would just comment, and I think would invite my colleagues' comments as well. One of the things we heard throughout this process, especially from our work with the management team and the executive team and from the director, was the need for focus, the need for prioritization, so the staff could really work in a coherent and aligned way on the highest priority items for the commission. And so what I think this plan does is a good job making sure that there's a plan around which now all of the commission staff efforts can be aligned. So I just want to make that comment.
Were you going to make comments, Karen?
No, thank you. For the sake of time, I'll just hand it back to you. Thank you.
Okay. Very good. Any other, Karen?
No, it's been an honor to serve on the committee. Really excited with the product that we created in such a short time and happy to move it forward.
With that, I will now entertain a motion regarding the strategic plan. Are we calling it an update, addendum, or the strategic plan update? The update, yes, as it is on the screen. Karen, would you like to make that motion?
I'll make the motion.
All right.
Second.
We have Larson motion, Sy second. For the motion on the screen that the commission adopt the strategic plan update for 26-27. Please unmute your lines. Commissioners joining us online and commissioners in the room, please speak your vote into your microphone. Commissioner Alvarez.
Abstain.
Commissioner Bear.
Aye.
Commissioner Burnick. Marking absent. Commissioner Bontrager.
Aye.
Commissioner Brown.
Aye.
Commissioner Bunch. Marking absent. Commissioner Callan.
Aye.
Commissioner Carnevale.
No.
Commissioner Contreras. Marking absent. Commissioner Designee Swartz.
Aye.
Commissioner Cross. Marking absent. Commissioner Fairweather. Marking absent. Commissioner Fernandez.
Aye.
Commissioner Gordon.
Aye.
Commissioner Designee Pomano.
Aye.
Commissioner Hill. Commissioner Hill.
Oh, aye.
Is that an aye?
Aye.
Thank you.
Aye.
Commissioner Larson.
Aye.
Commissioner Madrigal Weiss.
Aye.
Commissioner Mitchell. Commissioner Robinson.
Aye.
Commissioner Southard.
Aye.
Commissioner Thomas Beckett. Marking absent. Commissioner Sy.
Aye.
Commissioner Wilkes. Marking absent. Commissioner Chambers. Commissioner Roulette.
Aye.
Motion passes.
Again, because my numbering is out of order, I'm just going to check with staff. We are on agenda item 9, is that correct? And that would be lunch and closed session commissioners. We are going to hopefully reconvene at 12:30 p.m. We are skipping all stretch breaks, so commissioners, stretch as you're walking to lunch. And before we move to closed session, we will take public comment on this item. Mariani?
We do not have any public comment for closed session.
Okay, thank you, Mariani. A reminder to our virtual commissioners to please leave this meeting and join closed session via the Zoom link sent by commission staff. It will say closed session Zoom link with today's date. Again, we are going to try to return at 12:30. Okay, this is a little note here. All right, and reestablish quorum and report out from the closed session. If closed sessions runs longer than anticipated, we'll provide you with an update as quickly, as close to 12:30 as possible. But we anticipate returning at 12:30. Thank you all very much. Take good care. Hello, everyone. We are back, obviously. I hope you enjoy your lunch. We did. We had, first I'll have to ask Sandra to read. I don't believe I said that. Okay, Rochelle. She'll help me here in a second because we are moving. There's so many moving parts here today, just as it pertains to quorum. I'll ask Sandra to please reestablish quorum with the commissioner roll call.
Commissioner Alvarez. Marking absent. Commissioner Bear. Marking absent. Commissioner Burnick. Marking
Here.
absent. Oh, Burnick. Thank you.
Yes, no, I'm back here now.
Commissioner Bontrager.
Here.
Commissioner Brown.
Here.
Commissioner Bunch, marking absent. Commissioner Callan.
Here.
Commissioner Carnevale.
Here.
Commissioner Contreras, marking absent. Commissioner Designee Swartz. Commissioner Cross, marking absent. Commissioner Fairweather, marking absent. Commissioner Fernandez.
Here.
Commissioner Gordon. Here. Commissioner Designee Pulmano. Commissioner Hill.
Here.
Commissioner Larson. Commissioner Madrigal Weiss. Marking absent. Commissioner Mitchell. Commissioner Robinson. Commissioner Southard. Commissioner Southard. Marking absent. Commissioner Thomas Beckett. Marking absent. Commissioner Sy.
Here.
Who? Southard?
Southard.
Commissioner Southard's here.
Thank you. Commissioner Wilkes. Marking absent. Commissioner Chambers. Commissioner Roulette.
Here.
We have quorum.
Okay. Moving quickly before we lose quorum, during the closed session, the commission took the following actions. Number 1, approve the closed session minutes from January 22nd, 2026 and March 26, 2026. Approved, bullet number 2, approve the executive director performance evaluation for fiscal year 2025-2026. Number 3, approve the contract for Learning Resources Incorporated for the fiscal year 2026-2027 and for the executive director's review and coaching services. Again, we thank you, LRI, for being part of our team again in 2026-2027. With that, as we are, unfortunately, we are going to be losing quorum in a few minutes. So with that, I am going to transition to an adjournment unless, Sandra, there are other items. Okay, commissioners? Okay. All right. I would like to thank you all for being here. This has been quite a meeting, several unexpected absences, and all of which, again, we wish those commissioners, especially one particular commissioner, we wish him well, and again, pray that all is well with he and his family. I'd like to thank all our commissioners as well as members of the public and commission staff for joining us for our May meeting. Please go to our website, bhsoac.ca.gov, and sign up for emails to receive information about upcoming committee meetings over the summer. Our next full commission meeting will be on Thursday, August 27, 2026. With that, I will now adjourn this meeting. Thank you again to everyone for participating. Thank you for being here, and thank you for staying over, Commissioner. Thank you. Take care.